Okay, so I think we're ready to get started. So thanks everyone for taking some time out of your evening to spend with us talking about some allergy diagnosis and treatment. This is meant to be as part of a series of webinars that we want to host. So this is being the assessment and treatment for environmental allergies. This will also be recorded so you can view it at a later date as well. I do ask that you try to keep your mics off and put any questions into the chat box and we'll address them towards the end. And my intention for today is that we spend about 25, no more than 30 minutes max going through the actual presentation, and then we'll spend time at the end for questions. So we'll go ahead and get started. So just brief introduction. I'm Dr. Randi Brown. I'm a licensed naturopathic physician practicing here in Victoria at BETA Therapeutics. I have my pharmaceutical prescriptive authority, and I'm really passionate about treating seasonal allergies, eczema, asthma, and many common gastrointestinal conditions. My practice is essentially evidence-based, naturally focused, and patient-centered. And why I really love treating allergies is because I'm an avid outdoor enthusiast and an animal lover myself. And I really want everyone to enjoy sort of the therapeutic benefits of being outdoors and being around animals without being encumbered by their allergies. So that is my dog there on the right-hand side, and that's us enjoying the great outdoors. So we'll just jump right in. So I'll start off with kind of a funny meme. And as much as we kind of tend to brush off allergies commonly, why we should sort of all care about treating allergies is really because they do create a significant disruption in one's life. It can affect your academic performances, your work productivity, and overall decrease your quality of life. Not only that, but it contributes to millions of lost work and school days annually. And individuals with allergies require nearly double the annual prescription medications yearly than those that are unaffected by allergies. So this is fairly significant, and this is why I really want to spend the time talking to you all about it today. So just start off, kind of what are allergies? They're defined as an abnormal or an unusual response to a substance by the human body, aka a harmful reaction to an external substance. We call these substances allergens. So it's not that the substance in and of itself is harmful. It's basically having like an overzealous or an overreactive immune system that decides that that substance is bad and then creates that inflammation and ultimately the allergic symptoms. So what are the common allergens that we know of? So almost anything can be an allergy, whether it's biological, chemical, or synthetic in origin. Most commonly, these antigenic substances tend to contain proteins. This is why we see common allergies in things like peanuts, as well as milk, and then pollens as well, because they are dense in proteins. So because the focus is on environmental allergens, these are sort of the top ones that we look at. First one here being the pollens. So we can break that down into trees, grass, and weed pollens. These are what we call the seasonal allergens. So again, these have peak pollen seasons. So people tend to notice that their allergies will get worse during these peak pollen times, therefore seasonal allergies. Then we also have perennial, or basically year-long allergies to things like house dust mite, mold, and animal dander like cat and dog. And as well, you can have both a seasonal and a perennial allergy, which really kind of confuses the clinical picture and makes it really difficult to decipher what you're truly allergic to. And that just kind of highlights the importance of testing as well. So what are the allergic rhinitis symptoms? First of all, when I say allergic rhinitis, that's sort of synonymous with seasonal allergies. So if I say that word and that doesn't sound familiar, I really just mean seasonal allergies. So common symptoms being itchy, runny nose, eyes, nose and eyes, sniffing, coughing, and an itchy, kind of irritated throat. A lot of children might not be able to tell you that their throat is itchy, but you might hear what's called a palatal click, where essentially they're rubbing their tongue on the back of the roof of their mouth, and basically they're trying to like scrape or itch the back of their mouth with their tongue. So it creates that clicking sound as it suctions off of the roof of their mouth. As well, they can have itchy, irritated, dry skin, otherwise known as dermatitis, sinus irritation, so that can actually be facial pressure, pain, and headaches, and just non-specific symptoms like fatigue and malaise as well. So this is sort of the overview of allergies. So it starts by plants. They go into their flowering stage. In that stage, they release their pollens. Pollens are then kind of released into the air and spread by the wind. And then when we breathe these pollens in, they get attached to our nasal mucosa as we inhale them through our upper airways. When that happens, we have immune cells that are sitting right on the surface of those nasal mucosal cells that are ready to attack things like viruses and bacteria. However, in sensitized individuals, the pollens are what they end up attacking, thinking that they're bad. And this sort of release of histamine causes that inflammation and the allergic symptoms. So allergies are very common. They affect about 20% of all Canadians. And in fact, allergic rhinitis affects 1 in 5. And 80% of people with asthma will have some form of allergic rhinitis or allergic-induced asthma. So we can take a look at the Venn diagram there on the right-hand side. Of the 7.3 million Canadians with allergic rhinitis, we see a huge overlap with asthma. And we're actually now starting to think about these two sort of allergic syndromes as actually one continuous airway hyperreactivity to allergens. So from your upper airways, being your nose, mouth, throat, down into your lungs as well, manifesting as asthma. And again, these significantly impact your quality of life, school, and play. As well, allergic rhinitis is on the rise. So if we look at the graph on the right here, we can look back at 1960. In North America, that orange bar, less than 5% of individuals were affected by seasonal allergies. And if we fast forward to the 2000s, greater than 20% of people in North America are affected by seasonal allergies. So over a time frame of 40 years for that kind of spike to happen, that can't be explained by genetics alone. The human genome just doesn't change that quickly. So we have to look at what sort of environmental factors might be at play that's increasing our allergies today. And what research has basically found is a few things. So our increased exposure to indoor allergens. So we spend more time indoors. We have more carpets, more sofa surfaces that basically dust mites can live on. As well, we have changes in our hygiene. So we now treat our water. We basically have eradicated things like malaria and other parasites. And basically, we're just not playing with dirt like we used to, essentially, which all can affect our microbiome development and our immune system development. Third is lifestyle changes. So we sit more, we eat a little bit worse. Our rates of obesity have gone up. We have the standard American diet, or the SAD, which essentially it is. We have less vitamin D levels as well. And lastly, changes in climate. So research has actually shown that climate change can affect not only the pollen counts, but also their allergenicity. So not only does climate change affect the number of pollens year to year, but actually their potency, if you will, their allergenicity, so how much they'll actually affect you. And actually with that as well, it's increasing our pollen seasons. So what used to maybe be a tree pollen season of say 2 or 3 months would now be looking more like 3 or 4 months. And specifically here in Victoria, where we are, we already have a pretty moderate climate. So these pollen seasons can be quite long, so affecting individuals for a very long time. This is just a picture that I pulled out of a research article that I think just shows well the interplay here between our air pollution, our genetic susceptibility, and the aeroallergens. So those aeroallergens being the pollens, and how these create that heightened immune response together, creating allergies, asthma, and eczema. So if we sort of think of this as the genes load the gun and the environment as pulling the trigger, I think this picture just kind of brings it together well, that it takes all of these components to ultimately what creates allergies. Here's sort of the nitty-gritty of the mechanisms of allergic sensitization. And I don't mean for this to be super scientific. I just want to sort of introduce you to the players here so that later when we talk about treatment, it makes a little more sense. But I'll just draw your attention to the red circles in this graph. So if we look at the balance of basically Th2 to Th1 in the T regulatory cells, so there's 3 divisions that start off right off the bat. We know that people with allergic diseases like allergic rhinitis, eczema, and asthma, they tend to be Th2 predominant in their immune cells. That causes this release of inflammatory cytokines, which then increases your IgE levels. When pollens bind to those IgE, they ultimately bind the mast cells, which causes a release of histamine. All that histamine causes inflammation and allergic symptoms. So we'll come back to this towards the end as well. This is just a really simplified version of what I just showed you. So we just think of it as a balancing act between these two Th2 and immune sort of pro-inflammatory cells, and the Th1 and T regulatory cells being more inflammatory modulating and immune modulating. We can kind of tip the scales one way or another depending on our environment as well, but also genetics have kind of an underpinning in this as well. So is it really allergies? So maybe you suspect that you have allergies. And this is just a really good self-assessment to kind of either rule it in or rule it out and maybe need more assessment. So question 1 is there a specific trigger that always sets your symptoms off? In other terms, do your symptoms seem to be seasonal or do you have them all the time? Is it just on exposure with cat or dog? And do they noticeably improve on vacation? So again, if you remove yourself from that environment, do you notice that your allergic symptoms get better? And do you have parents or siblings with allergies? Again, that kind of highlights the genetic predisposition as well. And then last thing to ask yourself is, do you have an absence of fever or recent infection? Definitely important, especially in today's time, to make sure that we're ruling out any sort of viral or bacterial infection. Allergies won't cause a spike in your body temperature. And then just on the right here, I like to bring in the atopic triad. So basically, eczema, asthma, and hay fever tend to run in packs. So if you have one, you're more likely to develop the other. Again, this has a lot to do with genes as well as that Th2 predominance. Those inflammatory cytokines kind of all creating this perfect storm for all three of those to sort of run together quite commonly. Here's just an example of the pollen seasons in BC. So this, again, is part of that self-assessment of, maybe do you notice that your allergic symptoms are really only worse in August and September, which might indicate a ragweed allergy as compared to late spring and summer, maybe more grass, and then trees being in that early spring. I've actually talked to a few patients that were really confused about their allergies. They thought they shouldn't be experiencing their allergic symptoms because we're in the middle of summer. But then when we looked up the grass pollen counts regionally here in Victoria, they were very high. And so that created confusion for them because they were thinking more of the tree pollen season. But again, just that education piece was really helpful in bringing that back in for them and talking about what we can then do about it. And then as well, just at the bottom there, the cat, dog, dust mite, and molds are obviously year round and can definitely overlap with these seasonal variations as well. So more predisposing risk factors. So basically, why do some people develop allergies and others don't? One risk factor would be having first-degree relatives with asthma, eczema, or allergies. Again, that genetic underpinning is there. But as well, being of male sex, birth during the pollen season, being firstborn status, early use of antibiotics. We're still learning more about how the microbiome develops and how that regulates our immune system, but we do think that has a huge role to play in development of allergies. Maternal smoking exposure in the first year of life, and exposure to indoor allergens such as dust mite. So research has shown that if you have any one of these risk factors, that can increase your chance of developing allergies by 3 to 5-fold. So quite significant, especially if you have a number of these that kind of check the box. So in terms of allergy diagnosis, maybe you think you have an allergy, but you're just not exactly sure to what. So basically, how do we obtain that objective data? But first of all, why is testing for allergies important? Obviously, it supports a proper diagnosis. So symptoms of allergy don't always mean it's actually a true allergy. You can have a non-allergic syndrome that looks very similar to allergies, and obviously the treatment plans will be very different. So it's important to distinguish those. As well, you can identify the specific allergens. That's also essential for allergen avoidance measures. I always give my patients a specific allergen avoidant handout, and obviously we want to be very targeted in the recommendations that we make. Just makes things easier and kind of helps with compliance long term. As well, it's necessary for allergen specific treatments, which we will get to talk about more at the end. And lastly, there's an educational value there. So that visual reinforcement of allergy really strengthens your understanding and knowledge regarding your allergy awareness, and ultimately that leads to better treatment outcomes. Okay, so who should get tested if you're interested in all this? Basically, you're someone that has persistent symptoms of an allergy. Maybe you don't respond well to other medications, or the side effects seem intolerable to you, or for whatever reason, maybe you can't take the medications that are usually used. And as well, you have a willingness to comply with some other treatments. So how do we go about diagnosing an allergy? This is kind of the oldest tried and true method. This is the skin prick testing. Essentially what we do is we take a very small dilute amount of antigen, so things like cat or dog dander or some of the pollens, and we prick them just very superficially into the first few layers of the dermis or the skin. And then we basically measure this wheel and flare reaction. So for example, you can look on the left there, this young person, you can see number 6, that would indicate more of a positive reaction. that inflammation, that redness and swelling is indicating that positive histamine reaction so that this person is sensitized to that specific allergen. This is a quick, like 15, 20-minute test that's done in office. So basically the benefits of getting the skin prick testing, it's very quick, cost effective, and is generally considered very safe. You can visualize the reaction in real time because it's on your form, you can see everything as it happens. It's accurate and reliable. So again, this is the gold standard for diagnosing allergies. Some limitations or setbacks being they can cause local irritation, so you will get that redness and itching. It does require discontinuation of certain medications, things like antihistamines, which people are commonly on if they suspect they have allergies. And not everyone is a good candidate for this form of testing. So again, it's something that you need to talk to a physician about before you get this testing done in office. So the alternative to getting the skin prick test would be a dried blood spot allergy test. This is looking for allergy-specific IgE antibodies in your blood. Again, this is an in-office test. You can see here on the left, it's just a small little finger prick. All it requires is about 5 to 10 drops of blood. We send off the results and then we usually get them back within 2 to 3 weeks. So this is a great alternative to the sort of more provocative testing, if you will. So the pros of this type of testing is that basically everyone can be a candidate for this form. It provides accurate qualitative results, so it actually gives us the numbers. There's no histamine reaction. It's pretty quick. There's no venipuncture, no blood draw actually required, so it's generally best for kids. It doesn't require stopping the medications, and more allergens can be tested at one time. The limitations being that it generally is a little more expensive, and it is a little bit slower to get the results as well. This is just sort of a list of the antigens that we would test for in the blood. So if we look on the left at the environmental, it's everything between pollens of grass, weed, and tree, pet dander, molds, kind of everything there, as well as the venoms. And then you can see the key environmental factor sort of in the center there. That would be like the need to know for your environmental allergies, and then just more molds here on the right. So you can see this is a huge list. So obviously we wouldn't be able to test for all of these by doing skin prick testing. We tend to do skin prick testing for, no more than 20, but generally about 9 is the number we use for the skin prick. So this is what the actual results look like. So if we look at the left-hand side here, we're looking at the IgE antibodies. So again, the more levels you have of IgE, the more likely you are to have an allergy to that substance. And then if we look at the right-hand side, this is your IgG, otherwise known as sort of your exposure or your sensitization to that agent. This is generally considered your blocking potential. So where do we go from here? So maybe we've confirmed you have a specific allergy, and what are your treatment options? Generally, we go down the list from allergy avoidance measures, symptom management, and allergen-specific immunotherapy. So step 1, reducing your allergen exposure. Like I talked about, I give all my patients basically how to allergy-proof their life, but it's specific to their particular allergens. So this might be like a snippet of an example of what I would use for a pollen allergy. There's a lot here, so I'll just kind of point your direction to things like wearing a pollen mask if you're, mowing the lawn. Also rinsing your eyes with cool water or saline drops if you're out and being exposed to high amounts of pollen. Another big one is actually taking a shower and changing your clothes after you're outside, so you're not tracking those pollens actually into your house and then onto your linens and like in the bedroom, as well as other like sofas and surfaces. And then lastly, not hanging clothes to dry outside during the pollen season. Unfortunately, in Canada, our pollen seasons are basically the only seasons that we can actually dry our clothes outdoors. So generally, allergic patients, I do tell them to try to use warm water and then machine dry to try to kill off those pollens. And basically putting it outside kind of creates that sponge for the pollens that you then again just track those right back in. As well, here's pollen count. So weather.com is a good resource. I like that it breaks it down between tree, grass, and ragweed. Just good information in terms of when the peak pollens are. And then as well, they also have an air quality index, more for your asthmatic patients, which is great. And then lastly, for allergen avoidance, we have the cotton super weave. So this is the allergen avoidance bedding. It's basically has a super fine, less than 6 micron weave. So it keeps the dust mite allergens out. So great for anyone with eczema that has dust mite sensitivity, as well as asthma. So symptom management medications. So I'll note that they are very helpful at times, but they're definitely not without their drawbacks. So I've named some of the sort of more common symptom management medications for allergies. Antihistamines being the big one, definitely can cause drowsiness, dry mouth, urine retention, constipation, blurred vision, all being fairly common. As well, all these medications are really just symptom management and are lifelong sort of prescriptions. So you need to continue to take them season after season, year after year, day after day. So again, if that's, if you have allergies since the time you're 6 for your whole life, the cost of those medications really do add up because you just need to keep taking them over and over. This is just sort of another funny slide. You can't sneeze if you're unconscious. So again, drowsiness being one of the main side effects that we see with Benadryl. So other options being sublingual immunotherapy or SLIT. So this is the specific allergy treatments now. It's the only disease-modifying treatment for allergies, that with the allergy injections or SCIT, subcutaneous injection therapies. The sublingual immunotherapy or SLIT is an oral or sublingual application of a very dilute antigen or allergen in the form of drops or small pellets used to build immune tolerance to these allergens. SLIT's been available in Canada since 2013, and high-quality scientific studies have found that sublingual immunotherapy may improve symptoms of seasonal allergies like itchy eyes, runny nose, reduce medication requirements, and may improve mild asthma as well as oral allergy syndrome. So kind of going into how SLIT works in terms of how it builds that immune tolerance over time. Coming back to these players that we saw when we talked about, what's happening in allergies, I'll direct you to the green arrows. So first, we see that the sublingual immunotherapy is helping increase our T regulatory cells. So again, these are our immune modulating, sort of inflammatory modulating cells that ultimately can increase your IgG, indicating that tolerance and also that blocking potential. And then if we look up at our B lymphocytes, again, that green arrow going down. So it's decreasing the cells that are ultimately releasing that allergy-specific IgE, which would lead to the binding of mast cells and the release of histamine. So it kind of decreases all along that pathway. So again, the sublingual immunotherapy is the only therapy that we know that's actually changing that immune balance and actually getting at the root cause of the immune sort of dysfunction in allergies. Again, this is the simplified form. So we went back to that Th2, Th1 balance. This is a sublingual immunotherapy, sort of tipping the scales the other way and sort of rebalancing that immune system. A little bit more on the evidence for the use of SLIT for seasonal allergies. So all of these big kind of health organizations, including the World Health Organization, World Allergy Organization, and the Cochrane Collaboration, which is an independent third party, sort of, they evaluate the quality of the scientific literature and research, and they also take into account bias in research as well. So they sort of combine all the studies and look at the pool of evidence and then make statements about the effectiveness of these therapies. And basically they've all concluded that SLIT is a safe treatment, which significantly reduces symptoms and medication requirements in allergic rhinitis. A little bit more just on the Canadian Society of Allergy and Clinical Immunology. This is their position statements. So again, if we kind of start on the left, this is checking off all the boxes. So safety and efficacy, SLIT is effective and safe treatment for allergic rhinitis, as well as mild asthma, severe reactions being extremely rare. So again, safe. And SLIT versus the injections. So SCIT is AKA the allergy injections. So the application of SLIT is favored by good compliance, higher than that reported for the SCIT, in which the allergy injections are a major factor for non-compliance because of the inconvenience and its cost effectiveness. And then we look at medication use. So a significant reduction of both symptoms and medication use is observed with SLIT therapy. And then lastly, the SLIT strategy resulted in less expense in terms of both direct and indirect costs, and the break-even point of SLIT, that is the time to which the overall cost of treatment of SLIT for patients becomes lower than that for patients receiving medications alone, tends to be at about 4 years. So this is sort of consistent with the time frame that we use to actually treat patients with sublingual immunotherapy, and that it generally takes roughly 3 years to actually have lasting benefits. So you could stop taking the sublingual immunotherapy and see lasting allergy benefits beyond that 3-year time frame. So it's great that that sort of matches with the cost effectiveness of using the symptom management medications as well. So basically, in summary, you suspect you have allergies, you're not satisfied with your current symptom control medications. So what are your other options? First step is getting a specific allergy testing and diagnosis, whether that's by a skin prick test or a dried blood spot test. Second is employing some specific allergen avoidance measures, again, more targeted to your specific allergies, and allergen-specific immunotherapies, that being the sublingual immunotherapy. Then you can look at other lifestyle contributors. Again, when we look at sort of air quality, our pollutant exposure, gut health, and so on. And then lastly, referral to other healthcare professionals like allergists and immunologists for those more restricted therapies, including those allergy injections. I tend to, a naturopathic approach, I tend to start with the least invasive and then work up to more invasive as needed. So I would tend to, have patients try the sublingual immunotherapy first. And if they're not satisfied with their symptom control, then we'd be looking at a referral to an allergist or immunologist. But again, because the reactions are much higher with those injections, I tend to try to use the sublingual immunotherapy first because of its favorable safety profile. As well, it's an at-home administration. So as soon as you take the first dose in-house under medical supervision, just make sure everything's well tolerated. It's something that you actually then go home and take without direct medical supervision, which is a big added bonus versus having to come in each time for your injections. So that's sort of it. I will leave it up to questions and everything now. This is BETA Therapeutics contact information if you have any questions. We'll also be posting the webinar later. And then I just have the references here at the end. But I will leave you with this page and sort of open it up.
Sure, Randi. So we've got a couple of questions from some different people. The first one is, my son really wants a dog, but we think he may be allergic. Can we have him tested, and will treatment with allergy drops let us get a puppy?
Great question. I love it. I love dogs too, so totally understand. But essentially, yes, I would say it's worth a try. So definitely worth coming in, getting tested for it, and then considering some sublingual immunotherapy for that. And then ultimately, seeing how subsequent exposures are with the animal or pet dander itself. But in general, yeah, very good results.
The second question we have here is, do I need to have recently been around what I'm allergic to in order for the test to work? So cats or dogs or grass?
Generally, I would say I would err on the side of yes. Environmental allergies, it's less important to have had like a recent contact. Those IgE levels will usually be in the blood. I guess that's more specific to the dried blood spot testing too. For the skin prick testing, no. That histamine reaction will happen regardless.
Okay, and from the same person, why does it take a year or more to get in to see an allergist?
That's a very good question. I think just in general, there's like a pretty wide shortage of medical doctors all around, kind of very similar with getting into even a general practitioner here in BC. So I think even going up the chain and looking at specialists, it's even that much more difficult. So definitely can be frustrating, and that's why we sort of try to take on as much as we can as primary care providers in terms of taking that load off of the healthcare system and really helping patients get that therapeutic benefit much faster.
Okay, the next question is, can allergies occur later in life?
Yes, they can. In general, it's a little less common, but we definitely do see adult onset allergies. Specifically, maybe if you move to a slightly different climate, so something that maybe you weren't exposed to, and now you move from maybe Calgary to Victoria, and now you can experience seasonal allergies, but it can happen even without moving. It's definitely possible.
Okay, this person is asking, why have I heard that after moving to Vancouver Island, people usually develop seasonal allergies?
Yeah, again, similar thing. So you might actually be like exposed to different pollens that you wouldn't have been exposed to, in your other climate. As well, again, Victoria, because it's such a moderate climate, we do tend to have really long pollen seasons, and potentially more kind of potent pollens as well.
The next question is, will taking allergy drops reduce the amount of other over-the-counter drugs I need to take?
Yeah, definitely. So that's, may I go back to that slide one more time. But yeah, so the best research has really shown that it does both improve your symptom management as well as decreasing the medication you need to use for your symptoms long term. So generally it takes about 2 to 3 months to see that effect, but definitely you can start to see changes sooner. But that's generally when we say, you at least need to take this for 3 months. Ideally, you're going to take it for 3 years to have, lasting benefits beyond just when you take the sublingual immunotherapy. Just again, because it is the only disease modifying therapy we actually have or know, so it will create that lasting effect.
Are steroid drops harmful over the long term?
In general, depends on, if you're adult or a child, and what the dose essentially you're taking. This is steroid drops right now, like steroid drops, yeah. Yeah, and it just depends kind of the dose you're taking and for how long. So in general, we say the minimal effective dose. So just making sure that that's not the only thing that you're relying on and having to always increase your dose in order to get the same therapeutic benefit. If you find yourself doing that, then it might be time to consider an alternative therapy.
So this is one, my mom lives on the mainland. Is she able to make an appointment for testing, or do patients have to live on Vancouver Island?
Good question. So we do have telemedicine appointments available. And we can see patients from all over BC. However, if they are looking for more of the prick testing to be done, that's definitely an in-house treatment or testing service that we provide. However, we're happy to do, meet and greet consultations as well and sort of chat about their specific situation and see how we can best support them and help them.
And if people live on the mainland, are they still able to get the tongue drops?
Yes, again, you would have to be in-house for your first drops, just because you do need to be under medical supervision the first time you take the sublingual immunotherapy. After that, it could be like a telemedicine consultation and maybe every 3 to 6 months following up in person. But yeah, it's definitely possible for sure.
Is the blood drop test science-based?
Blood drop test,
Probably the AllerDetect.
Yeah, the AllerDetect, so the dried blood spot testing. Yes, definitely evidence-based. So it's considered like the second line, or basically the alternative if someone's not a candidate for the skin prick testing. And in general, they say that the sensitivity and specificity of the dried blood spot testing, or basically just like the serum IgE testing in general, can be anywhere from as low as 60 to as great as 90%, which is pretty on par with the skin prick testing.
And the last question that we have is testing safe for kids? And then also is the follow-up question is the immunotherapy safe for kids?
Yeah, generally, yes. I probably wouldn't want to do the skin prick testing on anyone under 5, but then they'd be a candidate for the dried blood spot testing as well. So yeah, there's lots of research that's looking at sublingual immunotherapy in children and like the prevention of asthma later in life as well. So for sure, they could be good candidates.
That's it.
Awesome. Okay, well, if anyone has sort of last minute questions, you can type it in the chat box. Otherwise, like I said, we'll have this up on the site, and yeah, you can always contact us at BETA Therapeutics. Yeah, thanks for all attending and spending your time with us this evening.